Hi, I'm Allison. I'm a CRNA student and I'm going to be doing an assessment on your head and lungs today, if that's okay. I'm going to wash my hands. I'm just going to give you a general assessment. Patient looks calm and comfortable, well dressed. Skin looks appropriate for ethnicity. No obvious bruising, lesions. Nails look clean, no clubbing. Capillary refill is greater than 2 seconds. Skin is warm and dry to touch. Next we'll move on to head. Assessing hair, even distribution. Scalp looks free of any flaking, scaling, or nevi. Skull looks normocephalic, no lumps or bumps noted. Next we'll move to eyes. General assessment, eyebrows, eyelashes, they look symmetrical and even distribution. Sclera looks white. Could you pull your lower lids down? Conjunctiva looks pink. There looks to be no redness or swelling on the eyelids or general eye area. Next, I will be testing your eye movements. If you could follow my finger with just your eyes. Testing the 6 cardinal movements. Movements are symmetrical and smooth. Now we'll go for convergence. If you could keep your eyes on it. Beautiful. Convergence looks good. Next, I will assess your pupillary response. If you could just keep your eyes open. Okay, pupils are equal round reactive at 5 millimeters. Next, I'm going to assess on the transverse to look for any abnormalities in your lens or cornea. If you could look straight ahead. Okay, cornea and lens look clear, no opacities. And then this side. Beautiful. Awesome. Next we'll test your vision. If you could cover one eye, we'll hold this about 6 feet away. If you could read the smallest line you can.
LTF PH.
Awesome. And right eye is 20/20 vision, and then again.
LTF PH.
Awesome. And left eye is also 20/20 vision. Next we'll assess peripheral vision. I'm going to cover one eye, look right at my nose. How many fingers am I holding up?
2. 1. 1. 2.
Okay, now this eye.
1. 2. 1.
Oops. Keep your eyes
1.
on me.
Oh, sorry. 1. 2. 1. 1.
Beautiful. Peripheral vision is equal. Next, I will use the ophthalmoscope. I would dim the lights if this was a real patient. And I probably would be on a seat that isn't so low, but this is what we've got. To assess the left eye, we're going to use left hand and my left eye. So I'm just going to hold your eye for your head for balance. Will you look at a wall just straight behind me? Okay, looking for that red reflex and then moving in, looking at the vasculature in the 4 quadrants, and then if you could look right at me for the macula, looks good. Okay, now we're switching hands, switching eye for switching his eye. If you could look right behind me again. Okay, got that red reflex, moving in, looking at the vasculature in the 4 quadrants. And then if you could look right at me. Beautiful. Awesome. Next, we'll move on to ears. Just inspection. Looks to be no redness, swelling, or lesions. And then the ears look to be symmetrical. We'll test your hearing next. If you could cover one ear. And then repeat after me. 99.
99.
Baseball.
Baseball.
Beautiful. Now switch ears. If you could cover this ear. Okay. 99.
99.
Baseball.
Baseball.
Beautiful. hearing's intact bilaterally. Next, we will use the otoscope to assess, I guess I'll start with this, the tympanic membrane. To do so, we're going to pull the external auricle up and back to straighten out the canal. The tympanic membrane is intact, slightly opaque, no redness, drainage, or swelling in the canal. And then if you could turn just a little bit, we will repeat on this side, pulling the pinna out and back. And the tympanic membrane again is intact, slightly opaque, no redness, swelling, or drainage. Next, we'll do the nose assessment. If you could cover one nostril and take a few deep breaths. Awesome. And then, sweet. A little bit congested, but no major blockages. Next, I will assess the inside the nares. First, okay, no redness, swelling, or drainage. And again, no redness, swelling, or drainage. Beautiful. Let's see. Next, I will assess the sinuses, starting with the frontal. Seems to be no tenderness. And the next maxillary, also no tenderness. Now moving on to the lymph nodes. I'm going to start with the preauricular, no tenderness, no swelling. Posterior auricular, temporal, submandibular, submental. The look straight ahead, superficial cervical, and then posterior cervical. And then if you could turn a little bit, the occipital. All are equal, no tenderness, no swelling. I'm gonna do your mouth next. I got ahead of myself there. You could turn this way just a little bit. Okay. If you could open up wide, I'm gonna check your cheeks. No redness, no swelling, no lesions. If you could stick your tongue up, or up, and then to the side, and then the other side, and then stick it all the way out and say ah. Okay. No redness, swelling, or lesions noted in the oral pharynx. Oh, and then could you pull your lip kind of down and out? Gums and lip look clear of redness, swelling, or lesions on both upper and lower. Beautiful. I'm going to do your thyroid next. Okay. If you could, just gonna place my finger just below the cricoid. If you could give, do a swallow for me. Beautiful. I could feel the isthmus moving up underneath my finger. And then next, the lateral. If you could give me a swallow. Okay, awesome. And then, sorry, one more. Swallow. Okay. No edema or swelling or tenderness in the lateral. What's it called? Thyroid. And then to end, could you take off your shirt?
Yes.
Awesome. I guess we'll quickly just do the supraclavicular lymph nodes. And could you give me a little shrug? Beautiful. No swelling or tenderness. If you could turn around, we'll start with the posterior lung assessment. Okay. First, we will do percussion. Percussion is resonant in all fields. And next we will do auscultation. If you could give me some deep breaths through your mouth, that would be awesome. Might have gone a little too low on that, but breath sounds are clear and equal bilaterally. If you could turn and face this side. We'll do the left lateral lung next. Only 2 lobes on this one, so we will just be doing 2 locations. Here's the upper and lower. Percussion is resonant. And then we'll auscultate. If you could take some deep breaths. And again. Awesome. And if you could do a 360 real quick. The right lung has 3 lobes, so we'll do 3 fields here. Awesome. Percussion is resonant on all fields. Now we'll auscultate. Take a deep breath through your lung or through your mouth. Beautiful. And then if you could face forward to finish us up. Okay. I'm going to percuss first. I'll pick that up. Okay. Percussion is resonant on all fields, and then we'll give it a quick listen. Take a deep breath. Awesome. Breath sounds are clear in all fields. And that's all I have for you. Thank you.